Welcome to Wax Off. My name is Robina Rayasat and I'm a hearing aid audiologist. I'll be talking through our earwax removal videos, so let's see some wax. This patient, let's call him Jamie Lannister. This is Jamie's left ear, and as you can see, he has some wax at the entrance of the ear canal and quite a big hole in the eardrum, which he's had since childhood. He has had intermittent discharge from this ear since he was a child, and he just accepted that this was something that he would have to deal with. That was until he saw us. I carried out an endoscopic earwax removal last year, and he's reported he hasn't had any discharge since then. So my aim for this earwax removal was to remove this buildup that you're seeing on screen at the moment to stop feedback of his hearing devices. So there goes the first piece, and it slowly goes straight into the tube, back in. And we're now dealing with that big piece of keratin, which begins to extend quite deeply, and that comes away nicely and again straight up into the tube. And these are the deeper layers of keratin, which again are quite thick, considering that they are quite deep in the ear canal. Huge skin pull just there. And again, you can see it's quite thick, it's opaque, and it's coming away into the probe quite easily, and it's breaking off at the point that it's ready to come out. Another great skin pull there. And a small amount on the roof of the ear canal. Now I'm going to go back in here to try to remove that little bit of keratin on the roof and get it from an angle underneath. And I'm sure Jamie won't mind me saying that the only reason why I was able to do this suction at this angle whilst he was seated is because he is a very tall individual, 6'5", meaning that I can get the endoscope to a point at the roof even whilst he's seated. And that's come away. And I'm happy with that. So here is a final shot of the left ear. You can see it's pretty red looking and it's got an obvious hole or perforation in it. It doesn't actually cause any discomfort to the patient, and he's had a lot of toing and froing with his doctor with infections and discharge over the years. So I'm not surprised that it looks a bit upset. It's got a lot of creaminess to it in places as well, which indicates a lot of scarring. So now the right side. You can see a very beautiful eardrum on this side, but again there is a partial amount of wax which is building up in the dip or the entrance to the ear canal. And if he wasn't a hearing device wearer, I would have left this wax in Jamie's ear and not done anything to it, as it would likely drop out on its own. But he is a hearing device wearer, and the part of the hearing device that sits just inside the ear was actually pushing up against this wax, so it was affecting the function of the hearing device. Now this wax is seated just where the hairs are also, so it's not an ideal view. The hairs are getting in the way of the probe end, but we are latching onto the wax, and the probe tip does somehow push the wax back a little bit while we are struggling to get a view through the hairs. And here we have a much better view. And that comes out really nicely. I'm battling to get the wax and debris which are intermingled with the hairs, and also to get a clear view too. I did adjust the focus on the camera here to get it to view the hairs and the exterior part of the ear canal, and you can see the sticky coating of the wax and the oil on the hairs. And what you can also see is that there is a small amount of wax on the anterior superior region, which is just a fancy name for the ear canal wall closest to the front of the face and the top of the eardrum. Again, a little adjustment here on the camera to get the view good for you guys. And as I get the endoscope through the hair, you can see that the wax peels off the ear canal wall really beautifully. And it certainly is a big one, but unfortunately it went straight into the tube as it came out of the ear. So here's the final shot of the eardrum. I have tried to get a good view of the crevices, particularly the anterior crevices. For a lovely viewer of mine, they know who they are, but it is very difficult to get views of this area just because of the curves and the dips of the ear canal and just the anatomy of the ear. And the fact that the camera also faces forward does pose a bit of an issue in getting those very tiny hidden areas. Maybe someone might at some point design an endoscope that picks up views that allow those areas to be viewed better. A perfectly healthy looking eardrum, a few bits of keratin just around the edge, but those are fine to leave in there. And we are finished with this procedure. Thank you so much for watching episode 25 of Wax Off. Please do keep coming back and watching each week on a Thursday. If you have any questions, as usual, please comment in the comment section below, and I will see you in the next one.